Okay. What is your name?
It's Patricia Lee.
And where do you work?
I work at Tesco's in-store pharmacy in Basildon, Southampton.
And what are your thoughts about?
Well, personally, I was very inspired by the presentation. It really, I already do MURs at work on a regular basis, but his talk sort of inspired me all over again to sort of look at them afresh and really tackle them head on. Especially the point that he made about what an MUR really is all about. Is it a clinical review, or is it just getting sort of numbers in? I think that many pharmacists are actually put off by the fact that they think it should really be an in-depth clinical review. I think a lot of pharmacists are put off by the fact that it should be, whether it should be a clinical review, an in-depth clinical review, or just a number crunching exercise, just getting as many MURs done as possible. And the point he made was that it was somewhere in between, that we should have the clinical knowledge to understand what our recommendations and changes that we make to patients' medicines are going to have on that patient, but not necessarily have to go in depth and write it all down or explain everything to the patient. And I like especially the point that if you don't find any, if everything is fine and you don't see that there's any problems, that simply just reinforcing a healthy lifestyle is basically all that needs to be said. But that's, again, enough to, make a difference to a patient.
What is your name?
My name is Eugene, Pastor Eugene Ide.
Okay. And where do you work?
At the moment I am a locum pharmacist.
Right, okay. And what are your thoughts about the MUR Evangelist Presentation?
I must be honest, it is, in the first place, the presentation is a mind-stimulating one. And MUR Evangelist, as it were, it's an approach the pharmacist should embrace, because looking at the benefits of MUR and the fact that it has been placed on the court of the pharmacist, who by his profession is a drug specialist, he gives us a lot of rooms and a lot of opportunities to make use of our professional knowledge to detail our patients as well as the medical doctors on the use of medication. And the benefits cannot be overemphasized, to be honest with you. It goes a long way to cut down costs, save lives, reduce the time spent in hospitals and everything. Yes, to be honest, it's quite an interesting thing to be an MUR evangelist.
Oh, good stuff.
Yeah.
Okay.
Yeah.
So, how would you be interested in signing up on the website and using it regularly?
I can tell you I'm making up my mind already. In the next couple of days I will definitely be fully registered on that website, because I think it's very interesting. Because for some group of pharmacists to bring out this idea, it is worth encouraging. And at the end of the day, it will help you to improve your professional practice. That is another aspect to it. So, and let's look at it from the financial point of view. Some employers pay you more, even as a locum, if you do MUR for them. So, from all angles, it is worth getting done and, getting involved in it.
Fantastic. Thank you.